Hello, everyone. I'm Dr. Victor Liu, a geriatric specialist practicing in the United States. Over the past 20 years working with older adults, there's one issue I've seen over and over again, yet it's often overlooked, and that's leg cramps. Many people think, oh, come on, everyone gets cramps sometimes. But let me ask you this. How many times have you been jolted awake in the middle of the night, your leg twisted, the pain so sharp you couldn't move? Have you ever been walking normally, when suddenly your calf tightens like a vice, forcing you to stop in your tracks? Or worse, do the cramps strike every single night, like clockwork, robbing you of sleep and leaving your body exhausted the next day? I understand that feeling. I once had a patient, Mr. Hoa, 68 years old, living in California, who shared, "Doctor, every night I have to sleep on my side because if I lie on my back, my left leg cramps up. Some nights I have to massage my leg 3 times just to fall back asleep. By morning, I feel drained. I don't want to eat breakfast or go outside." Sound familiar? Leg cramps may seem like a minor issue, but they are silently stealing quality of life from millions of older adults. And the sad reality is, most people don't know the true cause and don't realize that there are early ways to fix it. So what exactly is a leg cramp? According to the Mayo Clinic, a cramp is a sudden, involuntary muscle contraction that causes intense pain. It usually occurs in the calf, foot, and sometimes the thigh. The pain may last just seconds or a few minutes. But what makes it so distressing isn't just the length, it's the suddenness. It attacks without warning. In young people, cramps often come from overexertion in sports. But in older adults, they can signal underlying health issues and should be taken seriously. Why do older adults get cramps more often? This is one of the most common questions I hear from patients and their families. The simple answer: our bodies change with age. Blood circulation weakens, making muscles more prone to oxygen shortages. Peripheral nerves deteriorate, disrupting signals that control muscle movement. Muscle mass shrinks with age, yet mineral demands remain high. Many people are dehydrated, malnourished, or on medications that affect electrolyte balance. Please remember this. Leg cramps are not just a normal part of aging. They're a symptom, and they can be prevented if you know what to look for. Stethoscope hidden medical conditions behind leg cramps. Sometimes, leg cramps are the body's early warning sign of deeper issues such as deficiencies in magnesium, potassium, or calcium, key minerals for muscle function. Diabetes, which damages peripheral nerves. Peripheral artery disease, PAD, which reduces blood flow to the legs. Chronic venous insufficiency, causing blood to pool instead of returning to the heart. Side effects from medications like blood pressure drugs, diuretics, or statins. And keep in mind, cramps rarely come from just one cause. It's usually a mix of several factors. So how can you find out the true cause? The first step is listen to your body. Pay attention to what time of day do cramps strike? How long do they last? Are they accompanied by numbness, swelling, or skin discoloration? Are you on any new medications? Has your diet changed recently? These small clues help doctors like me create a full picture and pinpoint the root cause. I know you've been through years of experiences and endured your fair share of pain, but don't let leg cramps become a normal part of growing older. In the next section, I'll break down the top 6 medical causes of leg cramps in seniors, and you may be surprised to learn that many of them are completely preventable or treatable. If you found this information helpful, please subscribe to the channel and share it with your loved ones, because a simple act today could help someone sleep better tonight. 6 common causes of leg cramps in seniors, and how to recognize them. In the previous section, I mentioned that leg cramps in older adults are not an inevitable part of aging, but a cry for help from your body. Now, let's decode the 6 most common medical causes, according to U.S. research, that makes seniors more prone to nighttime leg cramps. 1. Mineral deficiency, the silent offender. Magnesium, potassium, and calcium are a super trio that help muscles contract and relax properly. A lack of any of these can disrupt muscle function, triggering sudden cramps. Why is this common in seniors? Digestion and nutrient absorption decline with age. Diets low in leafy greens, seeds, or fruits. Diuretics, common for high blood pressure, flush potassium and magnesium out of the body. Warning signs: muscle fatigue, light twitching, tingling in the feet, or jabbing pain when stepping out of bed. Doctor's tip: check your diet. Are you getting enough greens, beans, bananas, pumpkin seeds, and dairy? If not, it's time to add them in. 2. Dehydration and electrolyte imbalance, the nighttime troublemaker. It may sound simple, but dehydration is a surprisingly common cause among seniors. Without enough water, your body can't balance electrolytes, making muscles overly excitable. Why does this affect seniors more? Diminished thirst with age. Avoiding water to reduce nighttime urination. Hot weather or sweating without adequate replenishment. Clues to look for: dark urine, dry mouth, irritated tongue, fatigue. Doctor's tip: drink 1.5 to 2 liters of water daily in small sips. Try light electrolyte drinks, like coconut water, if you're outdoors often. 3. Medication side effects, the hidden culprit. Several common medications can cause leg cramps by disturbing muscle nerve signals or depleting electrolytes. Diuretics, like furosemide, hydrochlorothiazide. Cholesterol medications, statins. Certain blood pressure or antidepressant drugs. Real-life case. A 72-year-old patient came in with chronic cramps, and we discovered the cause was a diuretic prescribed 5 years ago. Doctor's tip: don't stop your meds on your own. Ask your doctor, could my medications be contributing to cramps? A small adjustment may make a big difference. 4. Poor circulation, a vascular red flag. Peripheral artery disease, PAD, occurs when arteries narrow due to plaque buildup, reducing blood flow to the legs. Muscles become oxygen-starved, and cramp as a result. Distinct signs: cramps during walking that ease with rest. Cold feet, numbness, brittle nails, slow-healing wounds. Doctor's tip: if you notice these symptoms, get a vascular ultrasound or an ABI test to assess leg blood flow. 5. Nerve disorders, misfires from the nervous system. Long-term diabetes, nerve inflammation, or spinal degeneration can interfere with signals from the brain to muscles, causing erratic contractions. How to recognize it: tingling, burning in the feet, numb toes, cramps paired with tremors or muscle weakness. Doctor's tip: if cramps come with unusual sensations, consider getting an EMG, electromyography, or a neurological evaluation. 6. Inactivity or prolonged sitting, lazy muscles. Many seniors move less due to fear of falling, joint pain, or simply staying indoors, but inactivity causes muscles to shorten and stiffen, raising cramp risk. Telltale signs: cramps after long rest or sudden position changes. Muscle fatigue or weakness when standing. Part 3. What to do when you get a leg cramp. 7 simple ways to relieve pain and prevent it at home. Now that we understand why leg cramps are common in older adults, today I'll show you practical, easy steps you can take right away. No medication, no medical equipment needed, to relieve the pain immediately and prevent future episodes over time. SOS button when a cramp hits. What to do? 1. Stop and gently stretch the muscle. When the pain starts, don't panic. Instead, sit up or stand if you were lying down. Stretch the cramped leg straight out. Place your heel on the floor and pull your toes upward toward your head, creating a 90-degree angle. Hold for 15 to 30 seconds. Repeat a few times. This is the quickest way to unlock the muscle from its contracted state. 2. Gently massage the cramped area. Use your palm to rub the affected area, the calf, sole, or thigh, depending on where the cramp occurred. Apply warming balm or herbal ointment if available. Benefit: stimulates blood flow and helps the muscle relax faster. 3. Apply heat or take a warm bath. If you have a heating pad or warm towel, place it on the cramping area for about 10 minutes. Heat dilates blood vessels and reduces the risk of another cramp in the following hours. Long-term prevention: just 5 minutes a day. Green circle 4. Stretch your legs before bed. Each night before getting into bed, do these 3 simple moves. Face a wall. Place 1 foot forward and 1 back. Lean forward to stretch the calves. While sitting, use a towel looped around your foot to gently pull it toward you. Rotate your ankles and stretch your toes 10 times per side. Just 5 minutes a day can reduce cramp frequency by up to 60%, according to Sleep Medicine Reviews, 2021. Green circle 5. Stay hydrated the smart way. Older adults should spread their water intake throughout the day. 1 glass in the morning, 2 to 3 glasses during the day, 1 small glass 1 hour before bed to avoid nighttime urination. Note: don't drink too much at once. It can upset your electrolyte balance. Green Circle 6. Eat more magnesium, potassium, and calcium-rich foods. Instead of just relying on supplements, prioritize natural sources. Magnesium, pumpkin seeds, oats, almonds. Potassium, bananas, avocados, papaya, sweet potatoes. Calcium, milk, sardines, spinach. If you consistently eat from these 3 food groups daily, your cramps may noticeably decrease within 1 to 2 weeks. Green Circle 7. Avoid sitting or lying down too long. Every 45 to 60 minutes, stand up, rotate your ankles, and take a few steps. Even if you're just watching TV or reading. Gentle movement keeps your muscles flexible and improves circulation. Doctor's reminder. If you've tried these tips for 1 to 2 weeks and still experience cramps, keep a cramp diary. When they happen, how long they last. Bring a list of current medications. Schedule a visit with a neurologist or general physician. Persistent cramps, especially those that cause swelling, prolonged pain, or muscle weakness, could signal serious conditions like vein blockage or nerve inflammation and should be addressed early. Leg cramps are common, but they shouldn't be ignored. With just a few small adjustments to your diet, movement, and muscle care, you can dramatically improve your sleep, reduce pain, and regain control of your legs. Doctor's tip. Light daily movement. 15 to 20 minutes of walking, senior yoga, or stretching can wake up your muscles and keep them healthy. As you can see, leg cramps in older adults rarely have just one cause. They're usually the result of multiple factors: dehydration, mineral deficiency, medication, underlying health issues, and low activity levels. The good news is, most of these are manageable if you receive the right advice and take consistent daily action. In the next section, I'll walk you through simple, science-backed home remedies to help prevent nighttime leg cramps effectively. If you found this helpful, don't forget to like the video, subscribe to the Senior Vitality Now channel, and share with your loved ones, because your small action today might help someone sleep better tonight. Part 4. Quick Q&A. Leg cramps in seniors. When should you be concerned? Hello everyone. This section is dedicated to answering the most common questions I hear from patients over 60, from whether you should take medication to when it's time to see a doctor. Question 1. Should I take medication to prevent leg cramps? Answer. Only if the cause is clearly linked to a mineral deficiency and your doctor has recommended it. In the U.S., doctors rarely prescribe medications like quinine because of their potential side effects. Lifestyle changes and diet adjustments are still the first-line approach. If supplements are needed, your doctor may suggest magnesium oxide, shown to reduce nighttime cramps. Calcium with vitamin D, especially if you have osteoporosis. Mild electrolyte solutions or tablets. Question 2. Do frequent cramps mean I have diabetes? Answer. Possibly. Leg cramps, especially if accompanied by numbness, tingling, or burning feet at night, can be a sign of diabetic peripheral neuropathy. You should get your blood sugar checked and see an endocrinologist if you have a history of diabetes. Frequently experience cramps and burning in the soles of your feet at night. Question 3. Are cramps always caused by calcium deficiency? Answer. Not always. While many assume calcium is the culprit, magnesium and potassium are actually more directly involved in muscle contractions and relaxation. However, low calcium can still contribute, especially in people who eat few dairy products or green leafy vegetables, have osteoporosis, or are postmenopausal women, suffer from chronic kidney disease. Best solution: get regular lab tests and follow your doctor's guidance on supplementation. Question 4. Should I apply heat or cold when I get a cramp? Answer. Heat is best right after a cramp begins. It helps muscles relax. If there's swelling or lingering pain, apply a cold pack for 10 to 15 minutes to reduce inflammation. Many people find that soaking feet in warm salt water before bed also helps reduce nighttime cramps. Question 5. When should I see a doctor? Answer. Seek medical attention if you experience cramps lasting more than 10 minutes, occurring nightly, swelling, redness, warmth, or bluish discoloration in the leg, numbness, weakness, or trouble standing, a history of diabetes, heart disease, or kidney problems, taking multiple medications without knowing potential interactions. These may be signs of deep vein thrombosis, nerve damage, or serious electrolyte imbalances, and need prompt treatment. Dear friends, In medicine, asking the right questions is often the first step toward healing. A leg cramp isn't just muscle pain, it's a message from your body. Listening carefully, understanding it, and responding wisely is the key to better sleep, stronger mobility, and healthier aging. If you have any more questions, leave a comment below the video or subscribe to the Senior Vitality Now channel to catch part 5, where I'll share a 1-week meal plan to reduce cramps and some simple at-home exercises.